Someone who is not metabolically healthy is at a risk of metabolic syndrome, a group of conditions that increases the likelihood of coronary heart disease, type 2 diabetes, stroke, and other health problems. In the United States, around 1 in 3 adults have metabolic syndrome. However, a new review published on January 2024 titled Reproductive Risk Factors Across the Female Life Course and Later Metabolic Health suggests that for women, not only lifestyle but the characteristics of the reproductive milestones may adversely impact the risk of metabolic dysfunction, which could lead to type 2 diabetes and high cholesterol. So today's story is about how irregular periods, polycystic ovary syndrome, are linked to high risk of diabetes and high cholesterol. I'm Amit Deshpande and you are with Star Health. In a few moments from now, I will present you a critical evaluation investigating the link between irregular periods, polycystic ovary syndrome and diabetes. So stay tuned and watch till the end. A person who is metabolically healthy has blood glucose, lipids, blood pressure and body mass index within the healthy range. The researchers who conducted the review suggest that screening for reproductive risk factors such as an early onset of menstruation, polycystic ovary syndrome, weight gain in pregnancy and severity of menopause symptoms may be an initial step to prevent or treat these metabolic diseases. The researchers reviewed evidence linking the traits of reproductive milestones with metabolic health and diseases and found that reproductive factors throughout lifetime were linked to metabolic health. These included early menarche, starting menstruation before the age of 12 was linked to abnormal blood glucose levels, high cholesterol, metabolic syndrome and type 2 diabetes. Irregular menstruation. Compared with regular menstruation, chronic irregular menstruation was linked to higher risk of developing type 2 diabetes. PCOS. The researchers found a strong relationship of PCOS with obesity and type 2 diabetes. Pregnancy. Gestational diabetes, excessive weight gain during pregnancy and gestational lipid levels were all linked to poor metabolic health in later life. Lactation. Longer lactation was linked to better metabolic health and lower risk of type 2 diabetes and metabolic syndrome. Menopause. Severe menopause symptoms and early menopause were linked to higher type 2 diabetes risk, but the researchers found evidence that postmenopausal estrogen therapy could decrease this risk. Although looking at what might cause these links was outside the scope of this research, most of these risk factors are linked to increased insulin resistance, leading to effect on metabolic health. Now the question is, what is the underlying mechanism? Is it genetics, hormone or excess fat? In their review, the researchers suggest that the majority of shared risk factors fall into one of the three categories: genetics, hormonal fluctuations, and resulting physiology or adiposity. Adiposity or excess body fat is linked to metabolic syndrome and is also linked to many of the reproductive factors investigated in this study, so could be one of the underlying causes. Experts say that there is a strong evidence that a link exists between reproductive risk factors and metabolic disease. To the extent that we can tell from the current evidence, the relationship between these adverse reproductive outcomes with metabolic health later in life, and is not explained by traditional risk factors such as excess adiposity, diet or physical inactivity. The researchers do not claim that traits of reproductive milestone causes metabolic disorders, but concluded that there are links. There may be other underlying factors linking them. Researchers do know it starts a spiral that leads to obesity, which creates more insulin resistance, which leads to an ovulatory cycle, which lowers sex hormone binding globulin, which leads to increased free testosterone. Although this study cannot show a causal relationship, acknowledging that these reproductive milestones may be risk factors is a step towards a better understanding of the development of metabolic dysfunction. However, the authors say further research is needed to understand these complex relationships. Reproductive milestones could be considered risk factors for poorer metabolic health in later life. In addition, other factors likely impact the trajectory of cardiometabolic health. Although individuals can't change their medical history, there are proactive actions that could potentially mitigate the adverse outcomes associated with adverse reproductive characteristics. So the take-home message is that lifestyle factors including diet, physical activity and medication management may improve outcomes even in people who are at a high risk of metabolic diseases because of their reproductive histories. Researchers are examining whether diet may modify the effect of certain reproductive risk factors on metabolic health, and hope to conduct more of this research in future. A healthy diet and lifestyle following the recommendations above can help mitigate the risk and reduce the likelihood of developing such conditions like type 2 diabetes and high cholesterol in later life. And that brings us to the end of today's story. For more medical updates, please do subscribe the channel. Thanks for watching. Signing off for now. Have a great day ahead. Thank you.